Prognostic subgroup among patients with stage 2 colon cancer. Definition: colon cancer is a cancer that is studied in the colon or the rectum. This cancer can also be named rectal cancer, depending on where they start. They are often grouped together because they have many features in common. Cancer starts when cells in the body begin to grow out of control. Cells in nearly any part of the body can become cancer and can spread to other areas of the body.
The large intestine is about 1 to 1.5 meters long. It is part of the intestinal canal which is between the small intestine and the rectum. A sphincter between the small and large intestine prevents digestive matter from retreating. The large intestine consists of an appendix and an ascending intestine, a transverse and declining large intestine, and the S-shaped large intestine which ends at the rectum. The large intestine consists of 2 layers of smooth muscular tissue covered by a mucosa. Liquid fluid is absorbed in the large intestine and becomes more compact as it progresses through the intestinal tract. The stool is stored in the rectum. Irregular bowel habits or stools containing blood are a cause to see a doctor. The doctor examines the stomach and checks the rectum with one finger. With the reason for suspecting cancer, the rectum is examined by performing a rectoscopy. A tissue sample may be taken. Further examination of the rectum and intestines is done by coloscopy. In this procedure, a flexible tube is inserted via the rectum, and tissue samples may be taken. Cancer found in the large intestine and rectum amount to approximately 50% of all cancer occurrences in Norway. Second to breast cancer found in women and prostate cancer in men, cancer found in the large intestine and rectum is the most common found in both sexes. Most cases arise without definite cause, with approximately 5% being inherited. Even though a great number of cancer cases remain localized in the large intestine or rectum, some tumors may grow directly into the abdominal wall, diaphragm, liver, stomach, duodenum, small intestine, pancreas, kidney or spleen.
Applications in medicine. Colon cancer has traditionally been treated surgically. However, many cases of colon cancer are systematic at the time of diagnosis. An apparently curative surgery is followed at a later date by tumor recurrence as a consequence of circulating tumor cells. Before the surgery, adjuvant medical therapy are designed to prevent recurrence after surgical resection. The current standard for clinical prognostication relies principally on pathology staining.
The large intestine, or colon, is a part of the gastrointestinal tract that makes and stores stool. It includes the ascending colon, transverse colon, descending colon, and the sigmoid colon. The cause of cancer is an uncontrolled multiplication of cells lining the colon. Before a true cancer develops, it usually begins as a non-cancerous growth called a polyp. Certain people can have multiple polyps in their colon, which are inherited genetically. Over a period of several years, a polyp has the potential to become cancerous. A cancerous polyp grows rapidly in size, eventually breaking through the wall of the colon and spreading through the tiny channels called lymph vessels. The cancer can also spread through blood vessels to other parts of the body. Symptoms of colon cancer are blood in the stools, a change in bowel habits, resulting in either more constipation or diarrhea than normal, abdominal pain, unintended weight loss. Treatment. Treatment varies depending on the stage of the disease. Some patients will need surgery to remove the diseased segment of the bowel, followed by radiotherapy or chemotherapy.
Pros. Treatment of all patients with stage 2 colon cancer is overtreatment, since only a small subgroup of patients derives any therapeutic benefit. Delbar in college performed a bioinformatics search for gene expression, signature obtained from population of stem cells and progenitor cells, and they found 16 genes in which expression was inversely related to the stem cells, like state CDX2 gene production suitable for detection.
Well over 100,000 Americans are diagnosed with colorectal cancer every year, and every year nearly 50,000 die of it. Tonight, Dr. John LaPook tells us about a new treatment that could prevent a lot of those deaths.
In the fall of 2013, Kate Winnie's cancer doctors gave her some very bad news.
We've gotten to that point now where unless something comes along, that's about it.
At the time, Winnie was 52 and worn out from a 7-year battle against colon cancer that included radiation, 9 surgeries, and multiple rounds of chemo.
That's a pretty scary place to be.
But Dr. Luis Diaz and colleagues at Johns Hopkins Kimmel Cancer Center tried a new approach. The immune system often has a hard time telling the difference between a normal cell and a cancer cell, but a specific mutation present in about 15 to 20% of colon cancers causes the cells to become very different from normal. Researchers theorized those highly abnormal cells would be much easier for the body's immune system to find.
Can we give one of these medications that turns on the immune system? And would that allow your immune system to then attack your tumor and remove it or eliminate it?
Kate had that mutation, and as part of a study of 38 patients with metastatic colon cancer who had failed conventional treatments, 13 had the genetic defect, 25 did not. All were given an immune-boosting drug called pembrolizumab. In 12 of the 13 with the genetic defect, the cancer either stopped growing or shrank. In the 25 others, the tumors continued to grow.
You were seeing these people who were really in an emergency situation in their life being returned to normal. And that's a pretty incredible observation and feeling.
Kate has received the therapy every 2 weeks for a year and a half. Her tumors have almost completely vanished, and she hasn't felt this well in years.
To have the blessing of being able to think down the road and say, gosh, I'm intend to be here for that is really incredible. It is. It's my own miracle.
Several of the authors have a patent pending related to the research. If it holds up over time, this approach could be used to treat other cancers with the same mutation, and Charlie helps select the patients who might benefit the most from this treatment, which can cost more than $100,000 a year. A very hopeful story. Thank you, Dr. John LaPook.
Cause approximately 20% of patients with stage 2 colon cancer have a recurrence, and an adjuvant chemotherapy provides a minimal benefit that is usually considered to be not worth the toxic effect of the drug. The use of adjuvant chemotherapy in patients with stage 2 colon cancer remains controversial because recurrence never develops in the vast majority of these patients.
Generally, depending on stage, the optimal chemotherapy or systemic therapy for colon cancer is based on a backbone of more traditional cytotoxic drugs, often referred to by patients as chemo, and more modern biologic drugs that we have used over the past few years, which are not traditional chemotherapy drugs, but have very specific side effects. So, when I discuss chemotherapy side effects with my patients, there are the general side effects that everybody should be aware of, such as fatigue, generalized weakness, lack of energy, nausea and vomiting. But it's important to realize in 2013 we have very, very good medication to control most of these side effects. So although we do mention them, it is more for the patient to be aware that these can occur, so the patient can bring those up so we can manage them. Nausea, fatigue, mouth sores, change in bowel habits, could be diarrhea or constipation, and infectious risk, bleeding risk because of effects in the bone marrow, white blood cell count will drop, platelet count will drop. The occasional patient might need red blood cell transfusion. Hair loss will depend on what chemotherapy agent is used, so it's actually not very common in most
frontline regimens for colon cancer patients, but that down the road it will happen. It's important to know the hair will grow back after that chemotherapy is completed. More rare side effects such as dysfunction in the heart, these are also temporarily, but we will talk about those with the patient. The biologic drugs that we have are geared toward the blood vessels to attack the blood vessels of the tumor and its supply. The approved drug is called bevacizumab. Obviously, because how it works, it affects blood cells. It does interfere with wound healing, so we don't use it 6 weeks before or after surgeries. And there's a small but real risk of serious complications such as bowel perforation, where you get a hole in your bowel, or major bleeding events. But those are really rare, and we try to select the right patient for the treatment. Another class of drugs that affects a specific protein called EGFR on the tumor cells is called cetuximab or panitumumab. These are very difficult names, but important to know that they have anti-tumor effect. They have very characteristic side effects such as a rash, which might be very mild, to actually very, very advanced, where the patient has to be treated with antibiotics and lotions. The good news for the patients is, I always tell them, it has been shown, if you do develop the rash, then you're more likely to respond to the therapy. Other side effects such as diarrhea and magnesium level changes, we're usually able to monitor and manage pretty well. So it's important for the patient to be aware of these side effects, so the patient and the doctor can discuss them, and almost all of them are treatable if we do it early.
Conclusion. The investigator focused on patients with stage 2 colon cancer and confirmed that CDX2 negative cancer, as compared with CDX2 positive cancer, was associated with significantly lower rates of survival. Finally, they used an expanded database to show that the administration of chemotherapy increased rates of disease-free survival from 56% to 91% among patients with stage 2 colon cancer and from 37% to 74% among patients with stage 3 colon cancer. This study provides an opportunity for oncologists to move beyond what has been an inadequate method of selecting patients with stage 2 colon cancer for adjuvant chemotherapy. Thank you.